Hello, my name is Rachel Stein. I'm one of the co-founders of VIP Pain Medicine. Before you start the strength and stretching exercises, we wanted to address something called the red flags of low back pain, just to make sure that there is a low concern for any serious cause of your low back pain before you begin this exercise regimen. So first off, what is a red flag of low back pain? Well, a red flag is a symptom or constellation of symptoms associated with low back pain that signify there is a more serious underlying condition as a cause of your low back pain. Everyone should be screened for red flag symptoms upon presentation of low back pain. If you are watching this video and have already seen a physician in regards to your low back pain, then you are most likely screened for red flag symptoms by the physician who is treating you. However, it is always good to double check for these symptoms before starting an exercise regimen. This slide lists the red flag symptoms of low back pain. Please listen carefully and note if you are currently experiencing any of these symptoms associated with your low back pain. Age greater than 50 or less than 20 years. Please note that most people with low back pain are above the age of 50. A positive red flag for being older than 50 should be taken into context with all the other red flag symptoms. For instance, if you are older than 50 but have no other red flag symptoms, then there is a lower index of suspicion for a serious underlying cause of your low back pain. History of cancer, especially prostate, breast, kidney, thyroid, lung, lymphoma, or myeloma. Immunosuppression, if you are currently taking any organ transplant medications such as cyclosporine, tacrolimus, azathioprine, and others. If you have a history of HIV. Signs of infection associated with your low back pain, such as fevers, chills, a recent urinary tract infection, a skin infection or furuncle overlying the skin of your spine, or if you are or were an IV drug user. History of trauma to the area, such as a motor vehicle accident, a fall from a height, such as a fall from a ladder, a direct blow to your back. If you are older than 70, minor falls, heavy lifting, or severe coughing that was the cause of your back pain are red flags, especially if you have a history of osteoporosis. Prolonged use of steroids, such as prednisone, use for weeks, months, or even years. The following symptoms are screening for something called cauda equina syndrome, which is a medical emergency. If you have any of these symptoms, then please report to the emergency department immediately. These symptoms include acute onset of urinary retention or overflow incontinence, meaning you're unable to void or urinate, or you had involuntary release of urine. Acute onset of fecal incontinence or loss of anal sphincter tone, meaning you had involuntary release of stool. Saddle anesthesia, meaning there is numbness or tingling or decreased sensation over your bilateral, so both of your inner thighs. And global or progressive weakness in lower extremities, meaning you're progressively feeling weak in your muscles and it's getting worse in both of your lower leg muscle groups. So, what should you do if you are positive for a red flag? If you have a positive red flag symptom or symptoms, or you are concerned that you may have a red flag symptom, then please schedule an appointment with your physician to discuss your concern. The physician may need to order follow-up lab testing or imaging studies such as X-ray, MRI, or CT in order to rule out any serious underlying condition that is the cause of your low back pain. I would like to mention that most of the information in this video was obtained from the Handbook of Neurosurgery written by Dr. Mark Greenberg. And thank you for watching. We look forward to helping you improve your low back pain, and we'll see you in the strength and stretching section.